The coronavirus first detected on December 31, 2019 in Wuhan, Hubei province has infected about 60,000 people and killed more than 1,000 according to the World Health Organization. The organization has gone on to declare the infection a global emergency. The Ghana Health Service's engagement on Thursday was to give updates on some of the contingency measures it has put in place in case of any eventuality. The 15 suspected cases that have been reported in Ghana have all turned negative. Every day, 2,500 people are screened at the Kotoka International Airport upon arrival in the country. At the engagement, health authorities assured that Ghana was adequately prepared to handle any coronavirus cases.
What we are saying that we have designated places that we could immediately bring into use if we need to. We do not want to mention them because it depends on where the situation is. So which ones will be more appropriate at any particular time. And so that's what we are looking at. Just that we have capacity to quarantine if there's a need to quarantine large people to look at that. Yeah. We have designated all our regional hospitals across the country as places where cases can be managed.
After several calls for their evacuation from Wuhan, the epicenter of the deadly virus in China, Ghanaian students have received 40,000 cedis from government for their upkeep as cities in the country have been put on lockdown. The money, which was sent to the National Union of Ghana Students NUG's China branch, is to be used for the purchase of food and protective items like nose masks and hand sanitizers for the student. Despite this, the Minority Caucus in Parliament on Tuesday gave government a 3-day ultimatum to evacuate Ghanaian students. Responding to these calls, Ghanaian authorities say China has the structures and systems to manage the situation and ensure the safety of Ghanaian students. Hence, evacuation is not an option.
When is the need to evacuate? I think that is what. These are citizens of Ghana, and systems are in place providing the needed support. We need to watch closely and see if the systems are getting down as they require. As much as possible, the need, then the support that they require, their livelihood, their well-being, are all these needs being met? So all these things are being monitored and then being handled such that as much as possible, their psychological framework will not be tortured.
People not getting infected. And it's the same system that we believe that the Chinese government has put in place to ensure that nobody
gets infected.
Is infected, and that is why people are not going out. There's a lockdown. They are distributing food for them. Even now, there's isolation. They speak to you. On phone, I've seen videos, I don't know whether they are fake or not, where robots are delivering food and things like that. So all these things are there to ensure that person-to-person contact is reduced as much as possible. Once those things break down, then it means that the risk of those students contracting is enhanced. Then maybe we will look at that, but for now, we don't see that.
The Ghana Health Service also announced measures put in place to screen passengers from China.
If the person has come from China, doesn't mean that he has come from. So that's why if you go to the port and the declaration form, there are a lot of questions. Where are you coming from? Which countries have you visited on your way here? Where do you live? Where is your address? So like Dr. Sakure said, if in case the flight has 400 people, eventually we find somebody on the flight who was positive, we need to trace everybody who disembarked to see where they are, because they are potential contacts. So we take all that information. They ask you whether are you coughing, do you have fever, do you have this. We take your temperature before you are allowed to leave. So basically these are the systems. So if that person came in and he's at risk, definitely, and those 15 we have seen, it is the same process that allowed us to say, no, I think there's some risk here. Let's test you before we let you out.
This is one of the health centers designated for coronavirus quarantine. This means the Ghana Health Service is prepared. They are on top of issues to deal with any eventualities. They've also assured Ghanaians that they have put adequate measures in place to tackle the situation. My name is Kojo Achman reporting for Citi News.